The government has issued a stark warning that we are at a tipping point on coronavirus cases and that there will be further restrictions in England unless people follow the rules. Tomorrow, Boris Johnson's key medical and scientific advisers will deliver a televised briefing on the threat posed by current cases and projections. A legal duty is being brought in to self-isolate if you test positive or have been identified as a close contact of someone who has, with thousands of pounds in fines possible. Our first report is from our political correspondent, Iain Watson.
When it comes to complying with rules and restrictions, the government says we're more lax than some of our continental counterparts. So as coronavirus cases increase, expect to hear tougher messages on enforcement. The Health Secretary says we're at tipping point.
If everybody follows the rules, then we can avoid further national lockdowns, but we of course have to be prepared to take action if that's what's necessary.
So we might be facing a further national lockdown if people don't obey the rules.
That's exactly right. I don't rule it out. I don't want to see it.
In just over a week from now in England, if you don't self-isolate when you should, you could face an initial fine of £1,000 and up to £10,000. The Health Secretary says we should tell the police if we see rule breakers, but in London, not everyone will take that advice.
That whole thing of telling on your neighbour, I think breaking up community is the last thing that should be encouraged.
If there's a hefty fine in place or something like that, people would maybe toe the line a bit better.
The Chief Medical Officer on his way to number 10 today. He and the government's scientific advisers have been pushing for swift action to slow the virus's spread. The Prime Minister's been in top-level meetings to discuss his options, but he's also under pressure from his next-door neighbour, the Chancellor, who doesn't want to see a fragile economic recovery killed off. So it is likely that we'll see new temporary measures across England, but that these will also fall far short of a full national lockdown. While schools and workplaces are likely to remain open, some of the restrictions imposed in local lockdowns seem set to spread across England. At the 212 Cafe and Bar in Leeds, there's no enthusiasm for a possible curfew.
Put a 10 o'clock curfew, most bars probably will decide not to open back up because trade won't be worth it for the late night venues. But also it could work in a different way where all the students, all the people go out through the day. The bars take the same amount of money, but obviously it'll just cause trouble through the day rather than the night.
Labour say they'll support whatever new steps the government takes, but
if I was the Prime Minister, I would apologise for the fact that we're in this situation with testing. Throughout the summer, we were saying prepare for the autumn. Instead, we had the exams fiasco. I would make fixing testing the #1 priority and reinstate the daily press conferences so we all know what's going on.
This is Boris Johnson's key adviser, Dominic Cummings, leaving Downing Street tonight after a long series of meetings. He and his boss's conclusion: we are all going to have to do better at following the rules if we're to bring coronavirus under control. Iain Watson, BBC News.
The latest government figures show the daily number of new infections remains high, with 3,899 cases recorded for the previous 24 hours. That means the average number of new cases per day in the last week was 3,679. The daily hospital numbers have also risen. 233 people were admitted on September the 18th. That figure does not include Scotland. There were 18 deaths of people who had tested positive for COVID-19 in the previous 28 days. On average, in the last week, there were 21 such deaths per day. And that takes the total number across the UK to 41,777. Ministers are meanwhile closely watching COVID cases elsewhere in Europe and the measures being taken in other countries. Our health correspondent Catherine Burns reports.
The intensive care unit in Marseille, one of the worst affected areas of France, a familiar sight across the world in spring and one becoming more common in parts of Europe as winter approaches. In Spain, this neighbourhood of Madrid and many others will go back into lockdown tomorrow.
People are concerned. I think there is an awareness or a realization that we relaxed too much, as many other countries did.
The question is, how do we compare to other countries across Europe? Well, over the last fortnight, if you look at cases for every 100,000 people, Spain is on the highest at around 300. France is approaching 200. Belgium and the Netherlands are just over 100, and we are lower than that on 69 cases for every 100,000 people. But other countries are much lower still. Italy, Sweden and Germany are all around 30, and Cyprus is just under 10. So the UK is at neither extreme, but the government is still watching the trends.
I'm not in this for a popularity contest. I'm in this to keep the country safe.
The concern is that as cases start to rise, that would be followed by an increase in deaths too. So let's again take Spain, for example. You can see that cases started to rise more and more sharply since the start of last month. There is an uptick in deaths too, but that's much more gradual at this point. So far in the UK, the number of deaths being reported is still relatively low. But there tends to be a 2 to 3 week lag in those worst cases, from someone getting infected, slowly getting more sick, to eventually dying. Empty streets in Antwerp after a curfew was brought in this summer. The government likes to point to Belgium as a more hopeful comparison, and stricter measures did seem to work there, but numbers are now starting to rise.
We shouldn't seize on one particular country, but we should select best practice from a number of different places. But the key thing is we do need to act now. We need to take action to reduce household mixing and introduce other measures to avoid more avoidable deaths in the weeks and months to come.
Right now, just as in the spring, we're potentially a few weeks behind countries with growing outbreaks in Europe. The question is how far the government will be prepared to act to prevent us being another Spain. Catherine Burns, BBC News.
Well, on that note, let's return to Iain Watson, who's in Downing Street. And we had that warning earlier today, Iain, to follow the rules or else. But how quickly is the government's thinking on this progressing?
I think it's moving pretty swiftly. The Chief Medical Officer, Chris Whitty, the Chief Scientific Advisor, Sir Patrick Vallance, will be giving a public briefing on the data tomorrow, Michelle. But behind closed doors in Downing Street today, they were meeting the Chancellor, the Health Secretary and, of course, the Prime Minister himself, poring over that data. Now, what's worrying some people inside Downing Street are grim predictions that the number of COVID deaths could rise to 200, perhaps 300 a day by the end of next month, unless people change their behaviour. Now, some ministers simply favour a stern warning, saying, look, follow the rules or new restrictions will be brought in. But other ministers are pressing for much swifter action. The time for new nationwide restrictions, they believe, is right now. Now, no definitive decisions were taken inside Downing Street today. Nonetheless, I understand the debate, Michelle, is around which temporary measures were brought in, not whether to bring them in, especially in the leisure industry. Now, the rule of six, remember that? It was only introduced less than a week ago, but it looks as though within days it could be superseded by much stricter measures on social distancing.
Iain Watson, thank you.